This is Dr. Brian Campbell. I wanted to take a few moments to go over the client history that I utilize in my private practice. I'm going to do that so that we can see some of the real-life implementation of a multitasking and integrative approach to Christian counseling. So one of the things we need to look at is the background of the individual, how he or she may have come to have the particular problem that she's presenting. We're going to use a female here. And how she might have developed that problem and what she sees as the nature of the problem, etc. It's going to be a lot of information. And a lot of it's going to be tapping into, look over to the right here, on the levels of analysis that we've already looked at. Biological, physical, psychological or cognitive, interpersonal, socioeconomic, sociocultural, and spiritual. So we're trying to get some information on a lot of different levels of analysis. The first page we can see has information regarding the age of the individual, family income, that's important. Let's look over here to the right. Family income might relate to socioeconomic status. If the person was very poor throughout her life, then she's going to have a tough time and she's going to have difficulties that relate to being in poverty. So we need to look at that, whether she is employed or not, and who she's living with. Now the marital status can be very important. That's over here on the interpersonal level. Whether the person has support or not support, whether she's been divorced or is still married. So we'll look at those factors. And so on the second page, we have a question regarding religion in childhood and religion as an adult. This is just a very quick screen to see whether or not the individual identifies with religion. And if not, then certainly that'll give us a lot of information. But if she does, then we might follow that up with a Christian experiences handout that I have to look more specifically at her faith and what she believes, because it's important to see what her belief system is coming into counseling. We have information on family here, living or deceased, father, mother, the implications of all that. That's over here. If you look to the right, that's the interpersonal level again. What order was she born in? Does she have brothers and sisters, etc. At the bottom of this page, we have state in your own words the nature of the main problems. We want to see what she feels is her main problem in her own words. That's very important. And then the next page, we have a brief account of the history or development. How does she feel that those problems develop? We also have a rating here of how severe the person feels the problem is, whether moderately severe, very severe, extremely severe. Then we have a question on medication. Of course, if we go over here to the levels of analysis, now we're getting into the biological level here. We're looking at factors that may relate to drug interactions, current medications, etc. So we want to ask the individual what she's on, what medication she's taking, and we're going to probably have to follow up on that and ask more questions about the medication. Personal data, mother's condition during birth. We want to see if anything happened during birth, whether there were any major childhood problems that occurred. That's background, that's history again. Can even relate to sociocultural, can relate to physical problems up here at level number 2, physical defects or deficits, whether there's any trauma during childbirth, etc. Might relate to intelligence and other things. Now, on the next page, we have listing your main fears, main factors that apply to you. Main fears first, and then main symptoms that apply to you. This is a very good little screening thing here, just to see what the person might underline, whether it's palpitations, feeling tense, feeling panicky. It's just a real quick screen to see what might be going on with the individual physically, psychologically, and in terms of feelings and emotions. Now underline any of the following words that apply. How does this person feel? How does she feel? Life is empty, inadequate, stupid. These are also indicators of belief systems and indicators of how she feels, and that's important to get a screening on that, initial view of that. Hobbies and outside activities. What's the person do other than work, if she works, and how does she occupy her time? That would be important for trying to look at the big picture with the client and see whether or not the person's really stressed, or whether they're balancing their life, whether she's balancing her life or not. Occupational data. We want to look at the history of her work history, what kind of work she had in the past, and of course, how much does she earn? This could be important once again as over here on the right, a socioeconomic factor that could relate to the problem that she's had. Ambitions, sexual data. This is very important. If the person's in a relationship, is their sex life satisfactory? Are they inhibited anyway? This has to do with biological factors over here and physical factors, and of course marital factors sometimes, and interpersonal factors down here, number 4.